Here's something about ankle planes on CT. So I got this case which has these 2 mm axial images. One's like a B30 and one's a B70. And the axials are fine. But then the coronals, if you look at the cut planes on the coronal images here, you can see that the image plane is parallel to the table. And when you look at the sagittal images, you see that the sagittal images are perpendicular to the tabletop. And again, not oriented according to the anatomy that we're interested in. And the problem here was that this was a 2 mm slice thickness. No 1 mm or smaller, thinner slice thicknesses were provided, which makes it difficult to reformat at the workstation. So I want to show you what the appropriate kind of imaging planes are. So one of the keys to recognize when you're doing an ankle image, now this is, they acquired the entire foot, which you're going to always get data on the whole foot, but really for an ankle we're focused on, this is the ankle joint, and then the subtalar joints, talonavicular and calcaneocuboid joints. Those are really what constitutes an ankle. And typically we kind of would cover the midfoot as well, just to make sure that we're covering what we need to. But because the ankle is requested, the anatomic plane of the ankle can be looked at on axial images between the malleoli, that is between the medial malleolus here and the lateral malleolus here. And we want to orient our image planes according to that. So you'd have, this would be, if you prescribe off these axial images and you do it this way, those would turn out to be coronal images, and if you did it perpendicular to that line, those would be sagittal images. So I did wind up doing that, and these are a little bit stair-steppy maybe, but just to show you what they look like. So first of all, I narrowed the field of view a little bit here because we didn't really need the whole foot. And then, so again, sorry for the bumpy look to this, but if I go to the malleolar line, you can see that I've now created these perpendicular to the malleolar line. I've rotated the image a little bit, and then the coronals also go along the malleoli. So if you compare the look, for instance, of this coronal image versus the original coronal image, you see how I can see both the malleoli in the same image here, but on the original images, here's the medial malleolus, and then here's the lateral malleolus, but it's not really aligned to the joint. And you can look on these axials, the original axials were not aligned according to the malleoli. So this is kind of what we're looking for without the stair-step appearance, so off of the original thin section acquisition or raw data. But that's how you should prescribe ankle CT.